Hi, Darren. Thank you. Thank you for the invite.
Okay, Liam,
Glad to be with you.
Okay, Liam, we spoke on this program on AirFM only 2 months ago, and our last interview then was very long, and it is still available on podcast, so we do not have to repeat everything that we said in that interview again today. We're doing this interview today because you told me that you have recently written a new paper on the issue of FASD. Can you start off for us, Liam, and for the benefit of anyone listening who didn't hear our last interview, can you start off by giving them a summary again, please, as to where you are coming from on the issue of FASD, and then tell us more about what is this new paper of yours?
Sure. Well, Darren, I suppose, we did discuss in the podcast, I've been in the field of fetal alcohol research now for over 15 years, I think. My first little piece coming out at Trinity College in 2007 was asking around the issue of drug and alcohol use in pregnancy as a child protection concern. I'm a registered social worker, clinical social worker, so I kind of came to this because in my practice, I was seeing children coming into the system as a result of substance misuse in pregnancy. At that time, I wasn't really clued in on the alcohol issue because alcohol is a legal substance in society and therefore something that we tend not to kind of question. But I suppose the more that I delved into the work and the research, the more I realized that alcohol is probably the biggest risk factor for a child in utero that is developing. And so that has kind of triggered me on to research and to publish, etc. I launched a little book there in the Mansion House back in 2013, I think, with Senator Gillian Van Turnhout, which is a book called Understanding Fetal Alcohol, a guide for parents, carers and professionals. That book was written with a foster parent because I know from my years of work in Ireland that this impacts foster care and adoptive families quite significantly. And again, I suppose this is where I'm trying to get social work to come to the table because these children are coming into the system and they are not being perhaps seen in the process of entering the system and getting placed in foster care. And that kind of brings me to the latest publication, which is kind of Seeing the Unseen, which was published there just in July. And again, it's a review focused mainly at social work and allied health professionals in Ireland. It follows on from my paper in 2023 called Capturing Invisibility, because in Capturing Invisibility, I propose a 5-step screening process that we could adopt in the child welfare system to see these children much earlier and to get the correct interventions and help for those children. Seeing the Unseen is really a development of that paper from 2023. And again, it kind of calls for really policy and procedure for social work and allied health in the system, dealing with these children that are coming into the system that have been impacted by prenatal alcohol exposure and do need some services and understanding that their brain impairment is likely to cause them difficulty in day-to-day activities. So that's kind of a very brief synopsis of where I'm at.
Okay.
Yeah.
Okay, Liam, can you remind me again as to what are the kind of symptoms people who have FASD have?
Sure. Well, I think it's very important to understand that fetal alcohol spectrum disorders is a range of different diagnoses that happens under the umbrella term. Now, there's a bit of a misinformation in society that FSD is diagnosable. It's not. That's the umbrella term. What is diagnosable is the many conditions that fall under it. Probably the most prominent, there's two prominent ones. One is fetal alcohol syndrome, which is where the child will actually have facial dysmorphic features and developmental. You will be able to see the issues because the alcohol has been perhaps It's more the end of the heavy use of alcohol exposure. And again, that probably all the way through from fetal alcohol syndrome, it's mild to severe. Now, one of the key diagnoses that was introduced in, I think, 2013 in the DSM-5 is NDPAE, which is neurodevelopmental disorder as a result of prenatal alcohol exposure. It's in the DSM-5. And that, again, it's coming to the fact that this is a hidden brain injury, and it's from mild to severe. And I think one of the challenges of the system and for child welfare is quite often the child welfare and social work is picking up the moderate to severe end of this disability. The mild end is yes, they need some tweaks, but people on the mild end can actually do quite well. It's the moderate to severe is where the problem lies in terms of understanding that disability. Now, again, when I say moderate to severe, I'm talking about neurocognitive, neurodevelopment, neurobehavioral presentations. Again, we are smothered in the research, Darren. We have 58 years of research. We know that this happens. We know that alcohol is a teratogen and it travels through the umbilical cord to the unborn child. We know that this neurodevelopment and neurodisability is in society. Unfortunately, because of the neurobehavioral, neurocognitive displays, many of these kids will end up really in difficulty. Like they transition from child welfare into the juvenile system, and the transition from childhood at 18 into the adult criminal justice system. That's on the more severe end of it. And I think it's one of the challenges of any society in looking at fetal alcohol is to understand that there are very, very big differences from mild to severe, and that a mild representation of fetal alcohol is not the complete representation of it. I have worked with many, many families. I've worked with many, many individuals with fetal alcohol, and I've seen this mild to severe concept in terms of how this disability impacts children. Again, in terms of your question is what might be the symptom, again, symptoms are so vast and so varied that it's not necessarily easy to just name one or two, because there's a lot of overlap with many of the other neurodisabilities that are in society. And so you have ADHD, you have autism, you have Asperger's syndrome, you have all of these neurodisabilities that are playing out in society, that many of them also are invisible. But society has grasped and taken on those disabilities, even though they're invisible, but not taken on the fetal alcohol disability that is perhaps very prevalent in Ireland, because we have, unfortunately, very high levels of documented alcohol in pregnancy. We have there's 3 clear epidemiology studies in Ireland, and they kind of talk about, I think Siobhan Barry was 65%, there's Mullally, and there's O'Keefe, and 65, 18, 82% of alcohol rate in pregnancy in Ireland. Now, again, people might get angry at me for talking about that, but all I'm doing is I'm highlighting what's already in the system. Perhaps that we didn't read it when it was published, but those are the reality. That's the reality. Now, again, someone will say to me, but 82%, is that any level of alcohol? And yes, it is any level of alcohol, because one of the big misinformations in society is that the 3rd trimester is safe. So unfortunately, a pregnant woman may feel that a glass of Chardonnay, 1 or 2 in the 3rd trimester is okay, but actually it's perhaps the highest risk, because that's where the fetal brain is actually maturing, and that's where alcohol as a teratogen can create that impairment by burning off some of the neurons that are being developed as part of, as I like to call it, the engine of human life, the brain, and all those fine pieces that need to be in place. Okay, I'm talking a lot. I'll let you come back at me, Darren.
I was just going to say, I'm delighted that my mum and dad don't. Well, my mum doesn't really drink at all. My dad rarely does. So when my mum was pregnant with me and my sister, she didn't even eat sugar for the 9 months. So she didn't take alcohol either. So I'm delighted about that. Liam, are you saying that fetal alcohol spectrum disorder, like some of the symptoms of it are actually illnesses, like for example autism? Can it actually cause these illnesses? Can it?
Not necessarily, but I think the problem is that in our unwillingness to acknowledge the neurodisability of fetal alcohol, we may mislabel and misdiagnose. And so there's a lot of evidence that say that children get diagnosed with ADHD that may be actually fetal alcohol and FASD. Because again, if we're not set up in society to acknowledge that this is happening, yet we have one of the highest alcohol rates in pregnancy throughout the world, then you have to ask, where are these children going in Ireland? If they're not so prevalent, then they must be getting misdiagnosed. And that is, again, clear. It's documented in the research that does happen. But again, I suppose coming back to, I mentioned our capturing invisibility and seeing the unseen. Both papers are focused on the fact that we have to disentangle the different neurodisabilities in society, because you can't use one brush for everything. There has to be, fetal alcohol has a specific need, as does ADHD, as does autism, as does Asperger's syndrome. I think it's very easy to just talk about, neurodiversity, neurodisabilities. But all of these disabilities are unique. The individual that has them is going to have unique and individual needs. So there's no one brush fits all. There's no easy fix. And again, capturing invisibility has got a screening tool, and it's about disentangling the various neurodisabilities in the service. And again, seeing the unseen, it talks about that we need policy, procedure, and protocol to do that work. But again, it comes back to who's responsible in society to take that on. Now, I know that the HSC is doing some really good work in terms of the prevention and the health promotion that is trying to prevent and reduce the alcohol rates in pregnancy. And I really commend HSC for doing that. I would encourage them to think multifaceted, to think of as many ways possible. And again, I suppose one of my kind of little bugbears, I would love to see a leaflet go into the SPHE program in second level education, because I think young people are going to buy into the message much quicker. So if we could get a leaflet into the SPHE program, that would help on the prevention thing. But I come back to the fact that, like, in terms of, sorry.
Go ahead. Go ahead. I was just seeing, is there anything else you're calling for? Like, just saying, you just said there you hope there's a leaflet and the subject for second level. Is there anything else you are calling for from the HSC and the government and other authorities?
Yeah, well, I think at the end of the day, Darren, there's 4 key areas in the whole fetal alcohol debate. One is prevention, which I just talked about, and the HSC is doing some good work. 2 is screening, identification, and assessment. That really falls under child welfare and under TRUSLA. 3 is lifelong services, because this disability is lifelong. And the lifelong services really falls across many divisions, but the Department of Education, for example, there's loads of evidence that these children are in the classroom and in the education system. And I think the fourth angle on that is the legal and ethical issues related to the process, because there's massive ethical issues. Like, I used to train social workers there in Ireland. The last session I did was 26, and it was 24 female social workers and 2 male. Ireland has, I think, around 5,000 social workers, and I think 84% are female. And I would understand that for female social workers in Ireland, this is a personal issue as much as a professional issue. Because most of those women are women of childbearing age themselves. So there's a lot of personal need, and this comes back again to the issue of competency-based education in the system, which I did do before the PhD, that they need to be able to process this information in order to then administer the professional components of it. So, but again, that's the four key areas that I think. And again, what I'd say to Darren, what I'd like to see is a national body, a task force, sitting down at a table with members of each of those divisions I talked about, and talking about this in terms of how best can we do this that is ethical, that is correctly done, that is legal, and that doesn't stigmatize birth mums. Now, again, that would be something that I would worry about in Ireland, because behind every child with a fetal alcohol impairment is a birth mum. And again, my research and my background is I've rarely met a birth mum that deliberately did this, that deliberately drank because she knew she was going to harm her unborn child. Women drink for many, many reasons. And you have domestic violence, you have wider addiction issues, you have mental health issues, you have all of these issues as to why a mother may drink in pregnancy. And then you have misinformation. Like I spoke earlier, society may say, sure, it's okay to have one or two. It's okay in the third trimester. These are misinformations that are in society because people don't want to buy into a professional message of fetal alcohol and understanding its impact. I don't know if that helps the question, Dan.
I never actually thought of that. Like what you're saying makes total sense, because I imagine that a lot of the women who drink particularly heavily when they're pregnant is because they're addicted to alcohol. That's kind of obvious, but I never actually thought of that. I was just thinking of kind of women drinking once a week on a Friday or Saturday night, but I suppose a lot of women do have addictions, and there's an argument as well that addiction itself is a mental illness.
No, I mean, obviously, I did the work there in the system. I don't know if anyone is left from the time I did the training and stuff, but I do encourage people to reach out to me if they're reading me, if they're wanting more information, that they can, It's certainly in terms of capturing visibility and the 5-step screening program. I do that in clinical practice here in the US. It is very, very doable. And I had the vision when doing my PhD that I would come back and train social workers to operate that 5-step screening program. But again, that didn't happen. And, certainly I brought forward my PhD at a worse time possible because it was the middle of the pandemic. And I know it wasn't an easy time for TUSLA or even the HSE to pick up this issue. We're still navigating challenging times, but I guess we will never have a perfect scenario or a utopia where things will be so good that we can now, we'll address fetal alcohol. There's always going to be challenges in society. I think we have to stop pushing this under the proverbial carpet. We need to address it, and we need to address it with the sensitivity, with the ethical lens. We don't need to use a sledgehammer to crack a nut, human rights law in that respect. Again, I'm very respectful that this is, issue for birth mums. I have trained alongside birth mums. I know their story. They shouldn't be blamed and cascaded in society and blamed for this issue. And again, this is an issue for social work that, again, about professional education and professional training, that social work wouldn't be blaming a birth mum for fetal alcohol. That shouldn't happen.
I read that the Minister for Health only said in the last year or so that she doesn't believe, or she didn't plan to make fetal alcohol spectrum disorder as an official disability. Like, Liam, are there people, do you think, in politics and in the health service in Ireland, public and private, who agree with you on this and are prepared to advocate somewhat to get this kind of committee, as you're calling for, established?
I do believe that there are people in society that totally agree and totally understand that this is a public health issue. I think, to those people that are still kind of maybe pushing it under the proverbial carpet, what I'll say to them is that this is a 10 billion a year health cost. The health costs of fetal alcohol are significant. And those health costs are in services, in mental health, in addiction, in homelessness, and blah, are all stemming from fetal alcohol. I kind of think if it's costing 10 billion a year, and those are international studies, again, you have to come back to Ireland and to the level of what the epidemiologists have said is the alcohol rate in pregnancy in Ireland, and to try and work out what it might be costing Irish society in that respect. But what I can guarantee that being proactive and to kind of address this is going to save money. It's going to save a lot of money. And I think, that is one reason why I would encourage people to sit down at a table and try and figure out what is the best way to prevent, to manage, and to kind of have those services in society under a legal and ethical lens. That is the challenge. Now, again, Darren, I'd say to you, the best service in the world is the province of Alberta in Canada. It has a population of 5.4 million, very similar to Ireland. But Darren, it has 24 multidisciplinary assessment centres. And Darren, how that came about in 1992, social workers and foster carers came together and they petitioned their political leaders in Alberta to address this issue because it was a burden on foster care and it's a burden on social work. And as a result of that is what I've just said, 24 multidisciplinary assessment centres for children and adults with fetal alcohol. So again, I come back to, yes, there are people in society that want to address it, but I think I worry that there's more people in society on the denial than there is on the acceptance of the issue. And that is part of the challenge of moving it forward.
Okay, Liam, it's great talking to you again. Just before you go, I read of this kind of connected social area issue recently, and I don't want to go off on another issue, but I'm just wondering, is the issue of FASD getting less attention maybe because of, even in the last 10 years, the growth in women smoking cannabis when they're pregnant? Because that's a growing issue as well, isn't it?
Yes, it is. But I think, the science, Darren, is quite clear that alcohol is by far the biggest and the most risk substance in pregnancy. Cannabis has some impact in terms of a low birth weight, but cannabis is not shown in any detailed way to affect the wiring of the brain of the fetus in utero. Alcohol does that, and that is why alcohol is by far bigger than cocaine, cannabis, whatever. Alcohol is the most dangerous. And that is kind of, again, when you're looking at the fact that, Darren, we have a love affair with alcohol. It's part of our cultural identity. And so it's not easy to talk about it in that way. But I do remember when I was doing the training in Ireland, Diageo actually funded the training of 10,000 midwives in the UK. And the reason for that funding was that midwives would document alcohol use in pregnancy on the clinical records. Because one of the biggest problems that we have in society now is that you cannot diagnose a child unless you have the physical evidence that alcohol was used in pregnancy. Unfortunately, the child will usually present much later, not at birth or infants. It's at the middle childhood to adolescent stage is where this disability becomes very pronounced, because their neurocognitive, neurobehavioral, neurodevelopment issues, when societal expectation comes on the child, because now they're at an age that they should know better, but because of their brain impairment, they can't do it. And this is where they cascade into difficult areas of society, because they're battling against a societal expectation for them to be normal. And yet they have this brain impairment that is causing them frustration, that they can't do that. So I'm not sure what was the question, Darren.
We're just talking about how you were saying alcohol is more damaging to to children when they're fetuses, when they're getting when women are pregnant, than cannabis and other drugs, other illegal drugs. Legal, some of them are legal now. I know cannabis is in some places. But no, it's just I read an article only a few months ago about cannabis in Ireland, and there's a growth in women smoking cannabis when they're pregnant, and I imagine it's even greater, the growth in the US, because a lot of states have legalized cannabis there. So I was just curious, but I didn't actually know that alcohol is a far more damaging drug to the developing fetus than cannabis and even cocaine.
Yeah. And that's again in the research, and it's clearly known that, and I'm going back to cannabis. Yes, obviously any substance when ingested during pregnancy has a risk factor to it, but cannabis goes low birth weight, and low birth weight can have significant issues as the child develops, because quite often children are born with low birth weight. They have health conditions and stuff that follow on, but that wouldn't necessarily be totally attributed to the cannabis use. But again, I'm coming back to alcohol is by far the most dangerous substance, and women need to be supported and helped. And again, I come back to the HSC prevention thing. I know they're trying. I know they're doing some good work, but I would say that they need to get out on multifaceted approaches. And I gave there one example of maybe getting a leaflet into SPHE program in second level education. But also I'd like to see, Darren, if you go into a doctor's surgery or into a health centre, that you might see a no alcohol in pregnancy poster almost framed on the wall. Something that will be there for years to come, concept, rather than just a leaflet that's sent out. Because again, the other issue, Darren, is that we're never going to get a utopia. We're not going to get next year that we'll have no fetal alcohol cases because we do the prevention now. Unfortunately, this is an ongoing issue. There's children being born with fetal alcohol every day across Ireland and across the world. So the prevention has to be continuous, and it has to be robust, and it has to be multifaceted in its approach. Again, for child welfare, I would really encourage the concept of trying to look at the 5-step and trying to apply the three Ps. So 5 steps and 3 Ps of policy, procedure, and protocol. That can help in the child welfare piece of the process.
And you think it's
all right?
And you think it's essential that the Minister for Health or the Secretary General of the Department of Health or HSE establish a committee made up of representatives from the various different areas to work on this issue, yeah?
I would say so, yes, because it has to be addressed through a professional lens and a competency lens, and it needs to be addressed with engaging with empirical evidence, not social media evidence per se. Again, I'm saying that I feel I've given in terms of capturing visibility and seeing the unseen. that I've given resources there that can be used as at least a foundational level for looking at this topic and moving forward from this on this topic. Yeah. Now, again, in my latest work, I'm very much focused on child welfare systems. In my earlier work, I was focused on foster care, etc., and I trained many foster carers in Ireland. But again, I'm coming back to it is a complex issue, and it needs to be looked at through professional standards and professional understanding of the complexity. And that's why I kind of say a task force, a working group, or whatever, with different representatives that are sitting down and are engaging with the empirical evidence to try and create a top-down concept of prevention, of education, of understanding that this is in society.